lost the two teeth a while ago. I was a teenager, I'd say 15, 16 at the time, 14. It was about around that time.
Yeah.
And I went to Dr. Gianin, and then he suggested to go see Dr. Gerlin.
Yes.
And when I went there, he had suggested to have 2 implants. I have to admit, I was nervous. I was.
What was it that made you most nervous about the whole recommendation?
The implants was nothing that I had done before. So, and what I heard about was 2 screws in the bone, going into the bone.
How did that make you feel?
Not very good. Okay. So, and then when I got here, you all calmed me down. I was very nervous. I was very concerned, and was actually a good experience.
How did not having those teeth there? How big of a problem was it for you? Was it a very important thing for you personally?
Well, it was, because I was getting used to, or already used to, but it's still, when I was eating, sometimes like something harder, like nuts, or I mean, would go there, and then sometimes it would hurt me. But now it's just perfect. I mean, it's amazing, actually.
I know that there was not enough bone initially because you had lost the teeth a long time ago and the bone had shrunk.
That's right.
And so one of the things we talked about was, in order to do these implants, that we need to do some bone grafting. Was that a surprise to you? What did you think about that at the time?
It was. I mean, I didn't know that the bone would shrink or would close. I mean, because of removing the tooth that was there. So if I was nervous, I got more nervous when you said that I had to do the bone grafting. Everything went very well, and the recovery was actually, everything was a lot faster than I expect. Actually, I went back to work next day. It was a lot easier. The implant was a lot easier, and honestly, I didn't even take any painkillers. At the first, I'd say the first week was a little strange, because I mean, it's been quite a few years that I've been without those teeth, but it took about a week to get used to, and looks like, I feel like they were always there. Very natural, very natural. I don't notice anything out of normal. Normal food. I mean, everything that from meat to fish, greens, with bones, without bones.
You feel very comfortable eating all
I eat
different kinds of food?
everything normally. I thought about, but didn't really, not care, but didn't really went forward with the idea of the implants. And when I first went there, it was just for a regular checkup, and he suggested that I should do the implants, and I was like, okay, but it doesn't really bother me. I mean, I already got used to it. It was harder at the beginning, and then I thought, well, but yeah, it does sometimes. I hurt myself with harder food, and so he explained me the process, and what was surprised to me was going to be done by 3 different doctors. I thought he would do everything.
I see.
I was used to that.
Yeah, you were used to that. Yeah.
And actually, this way, I mean, I think is better, because every single one can specialize better on just that thing that they do. Communication was very easy. Like I said, at the beginning I was a little nervous. It was not just going to the dentist and then to a cleaning. So it was a little more, actually a lot more than that, and everybody in all three offices, they were very nice in terms of explaining to me all of the process and how things were going to get done, and it calmed me down a little bit. It was a nice experience. I mean, it was in the communication, which is usually the most important part. Everything was explained to me very well. Some people said to me, "Oh, I would never do that." I was like, "Well, that's what I thought before. I would never do that." But I explained to them my experience over here, and said, "The whole thing was very easy."